You're listening to the Recovered Life Show.
Let's jump into this first segment, Kristina.
Absolutely.
You brought this to my attention, and I have to tell you, I didn't know a lot about it. And it's called EDMR.
EMDR.
EMDR. Okay, see how much I really don't know about it. So what is EMDR? I've heard about this in the recovery community.
Yes.
And I have to be honest, I have no idea what it is.
That's why I wanted to do this story, because a lot of people hear about it, but they don't understand. EMDR stands for eye movement desensitization. Say that 3 times fast.
I can't.
And reprocessing. And it has to do with lights and focus. You can find any EMDR practitioner by checking out your therapist. There are several that do this, and it is proven effective to reduce 80% of PTSD. While not being so painful. One of the things that I love about it, and it's why I want to recommend it to anybody, whether you're in new recovery or you are going down the road, this allows us to go back to a traumatic event and remember it without the feeling. So it's not causing harm. I work with a lot of people that don't want to go back there. And I can understand it caused a lot of trauma, but it's stuck. It's stuck in the body. And so it started in the 80s, the woman who developed it, when she noticed that there was a connection between traumatic and trauma feelings and what we would call a trigger and your eyes. And so it actually uses light and tempo to remember something. But what it's doing is allowing the amygdala and the hippocampus go ahead and finish the process. So it kind of overrides our memory by doing that. And then we don't have alarms stuck in our body.
Wow, that is interesting. So you know what came to mind, if anyone out here is dyslexic, shout out to me. They found, I remember even in the 70s and 80s, they knew that eye movement had a lot to do with tracking and reading. And I remember, doing those beads where you would focus on a bead within a distance, right? So is that like this? I mean, what does it actually look like if you're going under an EMDR therapy session?
Sure. Well, several different, but it has to do with tempo. Like they may make you hit the right leg and then the left leg. It's kind of like I said, a shortcut to those parts of your brain where the unprocessed trauma is stuck. So unprocessed trauma is like an alarm in your body. And anybody who's gone through it, they'll be doing something that's really, pretty innocuous. They're not used to it causing something, but it'll bump up against that unprocessed trauma and it will set off an alarm in our body. And many, many doctors and many, many therapists are starting to realize that that is the part that needs to continue. We need to be able to process the memory without the emotion. And so some practitioners use lights, some use tempo, some have you look at something while you're discussing an event. And I'll tell you, it won't feel, it's not a burning bush experience, although I have heard of people who've processed something and they used to have terrifying dreams every night and they're gone that first night. So I've heard of it happening that way. But most often there's just this deep sense, this de-escalation of anxiety, and you will feel rested, you'll feel calmer after even your first session. And within a couple of weeks, you'll start to notice something that used to take you off course isn't taking you off course. You no longer have the alarm in your body. And that's why I always tell people, look at this as a viable option to help you kind of walk through and know that you've done this. We both come from 12-step backgrounds where you're working through something that's incredibly tender for somebody in their inventory and they just can't go there. This allows you to finish the process and the memory can be released, the trauma can be released, and you will have peace. And I haven't heard of another one. I mean, there are all kinds of different things that are going on. When we think about PTSD, a lot of people think about soldiers and war, but PTSD and complex PTSD is much more prevalent in our world. And right now, even with the pandemic, many people could go in and treat their trauma when they used to think, it's kind of like the brain. They used to think that if you hurt a part of the brain, it was irreparable. Now they're realizing that neural pathways around that injured part of the brain can be grown, and the brain is very, very plastic. So
this is interesting. This is interesting because one of the things that you're bringing here is that this whole thing about these feelings that are in there that are causing this pain. Now, when you said 12 steps, what really came to mind was resentment, because resentment is reliving something over and over and over again. And in 12 steps, they're tying, and in a lot of different recovery things, they're tying resentments to relapsing and going out. They're also tying resentments to emotional pain and
right,
character defects.
right.
So are you saying that basically that the trauma, from what you've learned, is that the trauma isn't that really? It's something, it's a traumatic event that's maybe triggering this activity automatically?
Well, it's a way of rerouting it. It's a way of going around something that may be too emotional. So, as children, when we experience something traumatic, in order to survive, it's called a survival skill, you may not process it and push it somewhere else deep into your body. So, all of a sudden, you're doing well, you've been sober a little while, something happens and you start to shake, or you always have this low grade anxiety under everything that you're doing. An inventory is great. It is processing. But if somebody can't get to the root, then it's always going to be there. It's always going to be there waiting. It's like that sniper in the trees waiting for you. And so this takes a physiological approach that you can pair with emotional approach, and then you no longer have that alarm in your body. There is a Dr. Russell Kennedy who talks a lot about the alarm being in the body, and you can treat it with medications, you can treat it with rituals, but it's still stuck in there.
Yeah.
And I believe this is one of the most positive things that we can do for ourselves to help our nervous system integrate, because if our nervous system isn't integrated, we don't have access to our prefrontal cortex anyway, and you may just be stuffing that resentment even further down.
Yeah, I see that. I see that. And I see this working as, we had that episode with Stacey Danford that we talk about. And I
Yes,
can't remember what episode it was, but it was trauma and character defects. And she explains how sometimes it's not a character defects, it's just a trauma response. This is
absolutely.
kind of what I'm thinking here when you're talking about EMDR, Christina, is that the whole thing with this trauma response, it almost puts your body on autopilot, and being on autopilot is very dangerous for people who are alcoholics.
Oh, and the disassociation that saved us for a long time keeps us isolated from the solution. And we also talked about that one study that absolutely tied controlling behaviors to trauma. And that makes complete sense. If things were out of control in your childhood home, or things were not within a place, they weren't within a child's ability to respond to, they stay stuck. And then when we grow up, we want to control everything because we're trying to keep ourselves safe. And knowing what you and I both know, coming from a 12 step, we don't have a lot of control, but we do have within ourselves the ability to heal it. And that's why I wanted to do this study. If you've heard about it, do a little research, have a session. It's not painful, which sometimes things can be painful. It's not painful, but it is relieving.
Well, I know look, we're not EMDR
No.
therapists, so we're not, telling anybody or diagnosing anybody here on the Recovered Life Show. We never do that. But what we're about is bringing these cutting edge things that are going on in addiction and recovery, because I think it's important, because I have seen, and myself included, I've been stuck in certain areas and I've done the work, right?
Right.
I've done what the therapist has asked. I've done what 12 step has asked. I've done the work, but still sometimes there's this thing that's on autopilot and you're trying to figure out, Christina, like what is this about? And I've seen so many
Absolutely.
people relapse that have really done the work. Really, they've done the work, or they're miserable. It's like that they're miserable
Right.
and they just need that little extra thing. I like this. And can you explain a little bit about the pain? You were saying it's different than some therapies because you're not reliving the pain, right?
Well, it gives you access without having to walk through pain. So if you have a traumatic event in your past, or you lived a life and you can see on the outside there was a lot of trauma and you don't necessarily know how to, connect to it, this allows you to not have to connect to it, but be able to process it. And the pain sometimes, I mean, for many, many people, including myself, sometimes the pain was so overwhelming of having to understand my, ACOA issues, which is adult children of
Mm.
alcoholics, having to go there, that it prevented me from really going there. This is one of the tools that I use. I wouldn't say it's the only tool, but when it was explained to me, it was, 15 years ago, which is a lot different now. Now we have the studies that back up what it did. And it was very, very helpful for me to be able to take care of myself, because we're automatically going to disassociate with something that is too painful for us to live through. So this allowed me to take care of myself, take care of my nervous system, not have my daily life interrupted, but be able to go and really process it. It's amazing how well it works.
Yeah, it does seem like magic almost, right? Like, because I think that everybody's had this experience. At least I have. If you've been in addiction recovery for a while and you've worked either as a coach or as even, I would say, even a 12-step sponsor,
Right,
Christina, you've taken people through inventories. And
right,
what I find that happens, there are some people that have had a traumatic experience. Maybe it's been physically traumatic, maybe it's been a rape, or it's been they're a victim of a violent crime, or they had child abuse issues, right? Or something happened, right? They were in a
right.
very, very big accident. And there's a lot of what I'm just going to say emotional scar tissue
Yes,
around that topic. And what happens is you get there and you're right there to the place of healing. You're right there to breakthrough, but they can't, yeah, it's like everything shuts down.
it is.
And I think a lot of the times, as people who are trying to help other people in recovery, they feel, well, if only I could push my way through this, right?
Right.
This person. But I think that's dangerous. And I think a lot of people don't ask, in the recovery world that are working with people, it's like, hey, do you have trauma from anything? Were you a
Right.
victim of anything? Right. Like, because I think that there's a lot of people that are out there that are unqualified to lead people through. And I've seen people be pushed through that and
Right.
have the opposite negative responses.
Uh, Totally true. You're right on about that. And unless you're trauma informed, it should be one of the first questions we ask. It's definitely the first question I ask, because that's the field that I work in. Where is the trauma identified for you? Because I also think that people don't even realize that some of the events that they've lived through are traumatic. And so that injury is just sitting there in their body. And all they notice is that they kept paralyzed. One of the things that EMDR does is it helps us get out of the freeze mode. And we know fight, flight, freeze, and fawn. For freeze is definitely something that's more difficult to identify. And it'll look like you actually have a higher vibration when you start working through this. And it is so helpful for anyone who has suffered trauma or is stuck anywhere to do this. And why not add it to your tool belt?
Well, I have to say, what comes to mind when you say that is metaphysics. And
Mhm.
and I believe that there's a lot of metaphysics in recovery in general, right? And I think it's often misunderstood. I would even say, spirituality is a very similar
Yes,
response and reaction and result. Like, people who do spiritual work, they have this energy shift. And like, I'm always the one that says that I pound this into the ground, Christina. I'm kind of a fanatic about it, that recovery really is a consciousness game. It's a consciousness game, right? Like, once
it
you're
is.
in the consciousness, you're good. If you're out of the consciousness, you're in trouble, right? And so what we have to figure out as people that are in recovery, that are recovered, is how do we stay and get other people into this consciousness?
Right. And part of that is the information that we're able to give people. And it's also leading the way so that people can see that someone like myself, who had an incredibly traumatic childhood, is able to walk through it and still have feelings about, the things that happen today that are maybe a result of that trauma, but they don't take me out completely. I'm able to feel it, but it doesn't take over my body.
Yeah. Yeah.
And I think that people are afraid of that. So I absolutely encourage anybody to walk through this always with a professional, always with somebody who is trauma informed.
Yeah, I think one of the things is that if anybody's listening to this and you're in the recovery process, and I don't care if you've got a day or you have 30 or 50 days, I think if you're stuck, and I have that room on shameless plug here.
Yeah.
I have this room on Thursdays, which I love, in Recovered Life discussions on Clubhouse, which is all about getting unstuck. And I think getting unstuck, especially, I think this is even more important for people who have long-term recovery, is to identify these areas in which you're stuck and then ask yourself, hey, is there some sort of trauma that is involved in this? I mean, I remember being in a 12-step group and having somebody who was very well informed said, hey, that thing that you went through, that's very traumatic. And this isn't going to help you with that. Right. This is going to help you identify that something's up with that. But if you really want to get past that, you're going to need to go to somebody who can really help you get through that.
Correct. And we all need extra care. Sometimes we hear this, in a 12-step group that's an outside issue, but we are always needing to look at ourselves and do what is specifically good for you. If you've worked yourself, like you said, you pounded into the ground. If you've worked an issue over and over and over again, but you still have that little alarm knocking at your door, I mean, those are hints, those are clues,
right?
To keep going.
Absolutely. I'm so glad that we did this segment, Kristina, because, I love talking about new things in recovery. And I think one of the things that this scares people sometimes is talking about new things, because they say, well, I'm going to lose the old thing, or it's going to say that the old thing that I'm doing, or the thing that I've been doing for 20 years isn't going to work. I say no to that. I say BS to that. That's not true. I think it actually enhances what's actually going on with the stuff we've learned. And matter of fact, by doing the show, Kristina, I will tell you that I think the things that I learned in early recovery have been more proven now.
Right.
That science is coming out. It's amazing when you think about it. You go, wow, how did they know? Science is proving this now. There are some small ways in which, in languaging, I think it's more the languaging that people don't like, right? But languaging can change. But I have to tell you, I think it supports the case of how to get and stay sober long term.
It sure does. And it is it's literally, I have awe and wonder at the fact that they were able to create this over 80 years ago, because, I have a good friend, Stacey Danford, shout out to her, our neuroscientist. And the more she explains about blocks, the more that it ties right back into what I was taught about in the early days, because I'm so old. 25 years ago.
Look, you can't teach old dogs new tricks. I mean, that is one thing I've learned from being in recovery, is that as if you're alive, you have the opportunity to be able to change. And
keep the conversation going. Join Recovered Life, a community of like-minded people who are looking to live their best recovered lives. Membership is free, and you can apply at recoveredlife.us.